House Speaker Paul Ryan came out again today to defend a new plan to replace Obamacare, seeking to calm concerns of some in his own party.
This is what good conservative health care reform looks like. It is bold, and it is long overdue, and it is us fulfilling our promises. This is a conservative wish list. Look at what this bill does. It repeals Obamacare's taxes. It repeals Obamacare's spending, Medicaid expansion, and the Obamacare subsidies. It repeals the Obamacare mandates on individuals and businesses. It ends the funding for Planned Parenthood. This is what we've been dreaming about doing, and we know it's going to make a positive difference in people's lives in this country.
Speaker Ryan is confident the bill will get passed, even though not all Republicans are behind it. But that is rich, considering he needs 218 votes. There are 237 Republicans in the House, but the House Freedom Caucus votes as a block, all 29 of them. So do the math. It won't pass without their Freedom Caucus. And in the Senate, the bill still needs 50 votes. Right now they have 48. Rand Paul, among others, is not a fan of the new bill.
The current Medicaid is unfunded, and then we're going to add new entitlement programs to that. You say, oh, federal government's going to pay for it. Federal government has no money. We borrow $1 million a minute, so it's just dishonest accounting.
It's much akin to Christmas, where that oratory is a pretty ribbon and nice wrapping paper, but you open up the present and it's a lump of coal. And that's what this bill is. It is a lump of coal. It is the largest welfare program ever proposed by Republicans in the history of the Republican Party. It's going to be disastrous for our deficit and debt long term.
And this hour, President Trump will talk health care with GOP leaders at the White House. And there's word he'll start traveling the country soon to stump for the new plan. Here's more from his spokesman.
We're going to have a full court press. Our team is throughout the administration on local radio and local television to get that message right to the American people. To talk about both of the things that we talked about yesterday, why we have a crisis right now in health care and why Obamacare is failing. But then secondly, why the solution that the President's worked on with the House is the right one to bring down costs and to reinstitute choice.
All right, KG, Speaker Ryan called it a conservative wish list. I'm a conservative. I didn't see a lot on that I'm wishing for.
Didn't make your Christmas list or your birthday list.
Here's the problem.
Yeah.
There are a lot of things that he mentioned that will be incorporated in Phase 2 and Phase 3. They're asking us to make a leap that sign this now, agree to it now, and all those other things will make it into the bill. That's still up for conjecture. That's what Nancy Pelosi wanted us to do.
Right, exactly. Figure it out after you pass it. So you're right. They're going to say, listen, partner with us on this, and they're going to try to make the case. And they need someone who actually can do the job to make the case. I think nobody's going to be able to make the case from so far what I've heard and seen, except for President Trump. He's going to have to really push this with his base as part of his movement to say, we're on the right track. This is getting done. And, you know, I mean, Krauthammer had said, you know, listen, Republicans can't get everything they want. But what is the philosophy and the reasoning behind stage 1, stage 2, stage 3, the piecemeal approach, when for one of the most powerful times in history, they had such a reckoning that delivered them the House, delivered them the Senate, delivered them the Oval. If not now, you know, when? So
do you like the bill?
I'm trying to warm myself up to it.
All right, Bob, you know, there were change elections in 2010, 2014, largely on the backs of the dislike of the American people of the Obamacare law. Yeah, do the Republicans risk the same sort of change back the other way if this thing is unpopular?
Exactly. Look, you tell a little bit about this by looking at who's against it right away. American Hospital Association, National Healthcare Association, AARP, American College of Physicians, 40 of the top healthcare groups from New York to Georgia, California, 5 Republican senators, the Heritage Foundation, Freedom Works, Club for Growth. I mean, you got to be kidding me. First of all, Trump should not go out and stump on this because you got to forget what's in the bill. I mean, if they asked him a question, what's in that bill, he wouldn't have any idea. He'd probably say Obama's tapping him again. But
I have no idea what that means. Let me go to Meghan McCain. Meghan, Bob points something out very important.
I don't know what that means. Let me go to Meghan McCain.
The Koch brothers. I mean, there are a lot of conservative groups that don't like this so far.
And you and I are really on the same page with this. And I think both of us are in agreement that if the Republicans blow this, there will be ramifications in midterm elections. I can't overemphasize how important it is that they get this right. If I were President Trump right now, now, I would invite everyone from the Freedom Caucus that's really important, Rand Paul, Mark Sanford, Mark Sanford, all the people, these major players, come and say, what do we need to do to make this work? Because none of us want to hand over our political capital to the Democrats right now. And really, this thing lives and dies at the hands of the Freedom Caucus.
Brian, let's talk about this a little bit. The Freedom Caucus came out yesterday afternoon and said, look, here's what we want to do first. We want to repeal. We'll worry about replace later. There were a lot of people who said you got to be doing both.
You're not happy with that either. I mean, here's what he said. Let's repeal it, and then for 2 years we'll work on it, and everyone stays in place until we change it. Now, you know the market's better than anybody. The market's not going to love the uncertainty for the next 2 years as they meet when they have a chance in between stimulus packages, infrastructure deals, tax cuts, building the wall. So basically, what I understand it, and I'm not smart enough to fully digest it, when President Obama passed his law with an outline.
You're still welcome here.
Thank you very much. He passed his outline. We didn't know what was in it. Then there was a series of guidance letters and regulations coming from the Secretary of Health and Human Services that helped this out, Sebelius. Now what he's saying, Tom Price, is, you know me. You know I led the charge to take it out. Give me some power. That's phase 2. Phase 1 is passing this. I can't do it with 60 votes.
Thing, though?
Well, no. Rules and regulations.
Aren't they asking the Republican House and Senate to do the exact same thing that the Democrats did?
Can you name a Republican that was unhappy or felt that Tom Price was untrustworthy?
But he's right.
Nobody.
On this.
No, but you also have to. I'm sorry. You also have to consider. So we're all hanging our hat on the fact that Tom Price will be there straight through the process, doesn't vary on what he said he promised to put in. That's a lot of faith to put in one human being.
Eric is 100% right, though, that you're asking Republicans to do what Democrats jam down the throat. Asking Republicans to say, just hold on this, we'll amend this later, this is a work in progress. That is not good enough. I've heard you say multiple times, we've had 6 years to get this right, and this is the best we can come up with.
I think it is good enough.
I think it is good enough. Democrats need 35.
I don't go on faith in anything regarding politics whatsoever, because as you said, the market could change things. God knows what could end up happening, especially if we lose the midterm elections. I mean, it's just not good enough for the American public.
I was sure the Falcons were going to win the Super Bowl, but again, I don't know what to trust anymore. But I would say this: if you can't trust Tom Price,
after 6 years, this is as good as it is.
Well, put it this way: they got to be practical. They can only get 51 votes.
No,
come on, trust Tom Price. Come on, Tom Price.
But Megan's right on this. Look, 6 years. You have not only 6 years. 4 election cycles where you said Obamacare is so bad, we got to get the Democrats out of the House and out of the Senate. And guess what happened? The House flipped to Republican, the Senate went to Republican. You got them out, and you don't have a replacement.
Well, Paul Ryan said that he's working for 20 years on this, so that he's thought long and hard about it. This is what he put forward. They got the president to go ahead and agree on it. I'm just telling you. Hey, listen, over and over again, we said free market.
I'm just telling you, it's coming across state lines. Malpractice payments and block
when it gets in the bill, then maybe we say, okay, it's worth it.
We talk about the politics for a second.
Its weight in paper.
The politics are the 35 seats need to go over for the Democrats to take the House, right? Those 35 have been won by Hillary Clinton. One of the problems that Trump's going to have with his base in the off-year is his vote was heavily rural. And that's the lowest turnout in off-year elections. So that's one thing the Republicans have to worry about. The other thing is, frankly, how many Republicans don't want Trump going to go out and campaign for him? I mean, in some certain areas,
at the moment.
Oh, it's huge in certain areas. I agree with you. But you say Tom Price. You can't hang something on a secretary like that.
Well, I mean, it's not just one guy. I mean, you have a lot of people with some great ideas, and they got to get them woven into the final plan. But you can't get everything. Right. And you can't do number 2 unless you get done with Obamacare.
Are you saying you like this bill as it stands?
I'm saying that the potential for this bill is good enough to do it, sign it, amend it. Listen, for example, dinner tonight.
Do you know how much this bill costs?
Dinner tonight with Ted Cruz. Phone calls with Rand Paul. They're going to be able to get input into this. We're going to get a CBO, but I don't even trust the CBO after they had Obamacare.
Wait a minute. So you want? I mean, listen, I love you, right? And my problem is I hear this.
You could disagree with me
on the right all the time. We need to just do this, and we'll figure it out later because you know what? This is the best we got. No. Yeah. No, we can do better. We can find out how much it's going to cost. We're going to find out if, in fact, 20 million or 15 or 12 million people aren't going to be uninsured.
Just understand,
the day after
legislatively, and you know more than anybody else about legislation.
Yeah, but
if you repeal and then you replace, you need 60 votes. You are banking on switching 7 Democrats. That is a lot of faith.
Well,
at least you trust your guys to get it better.
You're talking about warring factions of the Republican Party, and I do hope the Freedom Caucus and President Trump can come together for the collective good of the Republican Party, because at the end of the day, we are Republicans, to try and get something that everyone is at least more collectively satisfied with than Medicaid expansion and a new system of tax credit right now, which is not conservative.
This is the most important. I think this is one of the the biggest issues, you're 100% right. Medicaid expansion, 138% above the poverty level. That's democratic. That is pure. That's liberalism. And
Bob
we're saying,
should like it
and we're
then.
saying, let's preserve this until
Now you know it's a bad
2020
idea.
and going forward.
Well, wait
at
a
least.
second. Just step back here for a second. The other players here are governors. In the states that took the Medicaid expansion, there's an old rule in Washington: what the federal government giveth, you never take back.
Right.
And I'm telling you, the idea that a Republican governor out there who's got a lot of people on federal Medicaid dollars, like Kasich, is going to somehow or another come out for this bill is nuts.
What if he ends up with a block grant in 2020, gives him more freedom to do what he wants?
You
don't want money?
That's
But part of the problem is the
idea.
entitlement culture that Democrats have created, starting with Obama. Now he has done a complete and total cultural paradigm shift. There's an expectation that health care is your right by the government.
It was the thing was Lyndon Johnson, 64, 65.
But okay, in 2017, he has effectively passed it, and the idea that you're going to remove entitlements from some people, I have a problem.
Can I do this? Can I ask anyone at the table or anyone out there, show me one thing in this bill that reduces the cost of either health care or health insurance?
Doesn't.
Not one. Just show me one. You know, it would. Competition. That's the only thing that's going to do it, and there's nothing competitive in here right now. You know who gets the best break in this whole thing? Not the American people, not the middle class, not young people, not old people.
Insurance companies.
Insurance company. $100 billion carve-out over 10 years to the insurance company.
You know,
guys, Republicans, conservatives, we've spoken, we've talked, we've voted, we've run on exactly opposite principles of this. The exact opposite of this. They need to fix
Don't worry,
this.
he's going to be okay.
Well, they're taking a bit of a knee on
Keep
it.
in mind,
He's not going to be okay.
He says block grants are coming. Malpractice insurance caps like they have in Texas is coming down the line. Having insurance you can get across state lines is coming.
Right.
And unless you don't believe Donald Trump, who tweeted out, it is coming. That was yesterday. He did it around 8 o'clock in the morning. Don't worry, it's going to be woven into the bill. Legislatively, this is how it's got to be done.
They want to wrap us, but I have to ask KG this. So, realistically, okay, so Donald Trump says, this is what I've been given. He didn't come up with this. This is what I've been given.
I know.
But wait,
Yeah,
he now has
the problem.
promised to repeal and replace Obamacare early. Is it smart for him to say, you know what, I promised to repeal and replace. We're not ready. Let's pull that back. We'll do taxes. We'll come back to Obamacare later. I'm sorry.
Well, no, this is one of the biggest things in terms of the campaign and one of the promises that was made early on. We saw that in terms of a shift in the campaign momentum towards Donald Trump when you saw just like Obamacare unraveling. So this was one of like the tent poles that he was trying to put forward. So that's why people are disappointed. They say, wait a second, this doesn't even go far enough. This seems a little bit like Democrats.
Donald Trump said everybody should get insurance in America and it should cost less. And it's not going to happen.
Donald Trump, President Trump is a free market guy. So the one thing that I was expecting and hoping for was to increase the competition, to bring the cost down, to ultimately make it more affordable so that the insurance companies don't win.
Politically, can he do it? Can he make the flip? Can he step back from Obamacare and say, sorry, American people, I promise you this?
Sorry? He's going to build off this. He's not going to say sorry. He's going to build. This is a foundational document.
Politically, can he do it?
He can fix it. I think he should meet with the Freedom Caucus as soon as possible and come up with some kind of
without them.
We got to go.
We got to go.